Obesity in America. Health officials say it's reached epidemic levels and no one is immune. It doesn't matter race, gender, age, socioeconomic status. Everyone is at risk, including small children. Right now, nearly 20% of all children in the U.S. are considered obese, including kids under 5. And as you can see, the numbers get higher as kids get older. Well, now a panel of experts are recommending early intervention therapy to try and tackle this issue. The U.S. Preventative Services Task Force says children as young as 6 should receive at least 26 hours of intensive counseling. So let's bring in Dr. Timothy Quinn, a board-certified family medicine and obesity specialist. Dr. Quinn, thank you so much for being with us. You know, the numbers, they certainly don't lie. They can be seen by some as disturbing, but right now this is just a recommendation. Do you think this type of counseling would really do anything? Could it do anything?
Well, as was noted, the research has demonstrated that this type of counseling, this early intervention with these young children that are living with obesity is actually beneficial. And the counseling is based on changing lifestyle habits as far as better activity, more exercise, less screen time, healthier meals. And with this counseling, and it's very important, I want to add that research has shown if you can involve the family as well. Don't just take the child into a room, but take the parents in the room at some point and share some of this information with the parents, because the parents are the ones that make the decision at the grocery store. And also on Saturday morning, are we going to get out there and exercise? This combination of counseling, this intensive counseling involving the parents, the research has shown that it is very helpful for these young people that are living with obesity.
You know, Dr. Quinn, it's like you're reading my mind, because that was my first question in all this. You know, what about the parents? Because if we're talking kids as young as 6, they are certainly not the decision makers, or at least they probably shouldn't be, when it comes to food, when it comes to activities in the home. So, shouldn't this counseling kind of be extended to parents and then, maybe the children as well?
Right. And that's so important. But also we have to educate our parents as well and help the parents understand that if your child is living with obesity, they have a much higher probability of having health-related consequences such as hypertension, diabetes, and all of these other problems that are more likely to manifest at an earlier time than if they could get healthier as far as getting to a healthier weight. But also with my parents, I like to talk about the psychological and also the social problems as far as a child living with obesity. There's a higher probability that child might have some anxiety, maybe some depression. Also, some studies have shown some children have lower self-esteem. Maybe they'll have lower scores on their test or their school performance. So overwhelmingly, once you educate the parents of the benefits and all of the risks that could be mitigated by helping these children get healthier, now you're on a track to getting these children to a healthier weight that they deserve by making those lifestyle changes.
Absolutely. And we know it can be hard to get adults to eat their vegetables sometimes, so it certainly can be difficult with kids. But Dr. Quinn, what do you think? Do you think that there's maybe some elements of victim blaming with this type of approach? Because do we as a society maybe need to do a better job of policing the entities at the top of this, the food producers, the companies which provide and create so much processed, and of course, it's quick and easy food, but many times that also means very low in nutrients and just not good for us.
This is correct. I actually did a segment a few weeks ago on a local station, your affiliate WLBT here down in Jackson, Mississippi, where I talked about ultra processed foods and the formulations, the chemical formulations of these foods in the laboratory before they're released. These foods are actually addictive to some people. A significant percentage of people are addicted to these foods, and it's hard for them to resist. And it's really an unfair situation, but also the advertising. If you are with your children and they watch television, like commercials, as far as doing as far as different programming for children, there's so many commercials where it's so enticing for these children. It's overwhelming for these children. That's why it's so important that these discussions are held, and I'm so happy for this, where we could even look at some legislation where there's some regulations where these companies are prohibited from advertising so much, a lot like the advertising for cigarettes that was brought about a while back for the overall good of society.
Yeah, it certainly is enticing. Because I got to tell you, Dr. Quinn, the pictures we were just showing of the donuts, those look good to me, but so did the vegetables and the fruit. Dr. Timothy Quinn, thank you so much.
Hey, thank you for having me.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.